Hi, I'm Dr. Seema Manjunath, fertility consultant at Cloud9 Hospitals, Tanisandra, Bangalore. PGS or PGD is a part of in vitro fertilization. Most of the human embryos that are made are abnormal. So when an abnormal embryo is transferred, it can fail to implant, or it can implant and causes miscarriage. It can implant, continue pregnancy, but the baby will end up with being born and having birth defects. So to eliminate these, there are many techniques called as Pre-Implantation Genetic Screening or Pre-Implantation Genetic Diagnosis. When it comes to screening, here we do only the check in the number of chromosomes that is present in the embryo, and whereas in diagnosis a particular genetic disease is diagnosed, let's say like beta-thalassemia or cystic fibrosis like condition. So how the procedure happens is we take out 2 or 3 cells when the embryo is formed, and they are sent for genetic testing. And once the test is back, the embryo having normal number of chromosomes are transferred back inside the uterus.